Good morning, class. I'm Mr. Booty, and welcome to English for Medical Sciences. Today, you'll have the opportunity to watch two students present on understanding invasive and non-invasive radiological procedures. Please have your pens or pencils and a piece of paper ready to jot down important points. This presentation serves as a model for your learning, designed to boost your confidence in understanding and discussing these topics.
Good afternoon, everyone. Before we begin our presentation today, allow us to introduce ourselves. My name is Rizma and my friend is Farhan. We are the 5th semester students of Radiology Study Program, Widya Husada, University, Semarang. We are pleased to be here to discuss understanding invasive and non-invasive radiological procedures. There are 11 points we are going to discuss. I am going to talk about point 8 until 13 and my friend, Farhan, is going to talk about point 1 until 7.
Okay. Thank you, Rizma. Now I am going to talk about the importance of radiological procedures. Firstly, non-invasive and invasive radiological procedures provide valuable insights into the human body. Secondly, they aid in early disease detection and improve patient outcomes. In our presentation, we'll explore the definition, types, purpose, advantages, and risks of these procedures. The next slide will discuss the objectives of the presentation. There are 3 objectives we are going to achieve. At the end of the presentation, we will gain a comprehensive understanding of radiological procedures, differentiate between invasive and non-invasive techniques, and learn about their uses, advantages, and potential risks. After discussing the objectives of the presentation, now I am going to talk about definition of radiological procedures. Do you know what radiology procedure are? Radiological procedures involve the use of medical imaging to visualize internal structures of the body. There are 2 radiological procedures. The first is invasive and the second is non-invasive procedures. Rizma will explain the difference between invasive and non-invasive procedure.
Thank you, Farhan. Non-invasive procedures do not require penetration of the body, while invasive ones do. The examples of non-invasive procedures are X-rays. This procedure uses ionizing radiation for imaging. The second is CT scans, for example, detailed cross-sectional imaging. The third is MRI scans, detailed images using magnetic fields. The last is ultrasound, uses sound waves for imaging. After discussion, the purposes of radiological procedures. Now I am going to talk about the advantages of non-invasive procedures. There are several benefits of non-invasive techniques. Firstly, in terms of safety, non-invasive procedure is safer as they have a lower risk to patients, minimal discomfort as they have less pain and shorter recovery. They also have less risk of infection as there are no surgical incisions. Finally, they have a wider patient acceptance. There are several benefits of invasive techniques as they have good precision, for example, direct access to targeted areas. Secondly, they have therapeutic potentials as they have treatments performed during the procedure. In addition, they have detailed information because of high-resolution imaging. Lastly, they can be curative for some conditions. Now Farhan will continue the presentation.
Thank you, Rizma. Now, I am going to talk about the risks and complications. There are 2 the potential risks and complications. The first is infection, bleeding, allergic reactions, radiation exposure, etc. The second is the importance of informed consent as patients must understand potential risks. After discussing the risks and complications, I am going to discuss preparing for a radiological procedure. There are several steps patients should take before the procedure. The first is fasting for certain exams. They must discuss with healthcare provider. The second is clothing. Patients wear comfortable, loose-fitting attire. Lastly, they provide medical history, inform the radiology team. Now, Rizma will continue the presentation.
Thank you, Rizma. Now I am going to talk about the risks and complications. There are 2 the potential risks and complications. The first is infection, bleeding, allergic reactions, radiation exposure, etc. The second is the importance of informed consent, as patients must understand potential risks. After discussing the risks and complications, I am going to discuss preparing for a radiological procedure. There are several steps patients should take before the procedure. The first is fasting for certain exams. They must discuss with healthcare provider. The second is clothing. Patients wear comfortable, loose-fitting attire. Lastly, they provide medical history. Inform the radiology team. Now I am going to discuss what to do during and after the procedures. We will do an overview of what happens during a radiological procedure. The first is patient positioning. The second is the use of contrast agents, if applicable. The third is the role of the radiology team in guiding the procedure. After the procedure, we must do post-procedure care and recovery, monitoring for immediate side effects, instructions for resuming normal activities, and follow-up appointments and results. In summary, understanding the differences between invasive and non-invasive radiological procedures is very important in addition to their significance in healthcare. Another key point is that the importance of informed decision-making regarding these procedures. That's all about our presentation today, and thank you for listening.